The last 1 year has been extremely traumatic for Afghan citizens, especially for the women. Much of the progress made in the last 20 years was wiped out by the Taliban. As a result, mental health issues are on the rise. The Taliban have no dedicated plan to tackle the crisis, so individual doctors and therapists must take the lead. We bring you the story of one such therapist of the Kapisa province.
This has become a daily routine for Firozan Jamshedi. The bus ride from Kabul to Kapisa may seem long, but it is necessary. Firozan is a mental health consultant. She works at the provincial hospital in Kapisa. As she dons her white coat for the day, a long queue has already formed outside. Tells you how serious the problem is.
Right now there are a lot of problems. There used to be institutions to help these people by paying them money, and those who were afraid of their fathers, brothers and husbands. There were shelters for them to stay until their problems and issues were resolved. Now there is nothing.
Most of our patients are women. The Taliban rule has throttled their life. You can imagine what it's like for them. 20 years of progress wiped out overnight. The new rules mandate them to cover their face, mostly stay at home, and deny them equal job opportunities. Firozan meets many women who've contemplated suicide.
We have too many patients. There are lots of suicides, and in May, we even had 4 suicides in 1 week. One of them had hung herself and the other 3 had eaten rat poison and the families did not know. They said a 5th one killed herself with a hunting rifle. They said she killed herself, but we know that her brother or whoever it was killed her.
Firozan does important but risky work. Mental health isn't really a priority for the Taliban. This particular mental health department opened in 2013. Even back then, many questions were asked.
When the mental health department opened in 2013, at first the hospital staff considered this mental health work to be very odd. They used to say, we prescribe medicines and give treatment, but that has no effect. How could they do it with their storytelling of 10 to 15 minutes?
In Afghanistan, mental health is seldom talked about. The result? It is a silent pandemic. 1 in 2 Afghans suffer from some kind of psychological distress. The reason is obvious. Decades of war have exposed Afghans to immeasurable trauma. The fighting, the instability, the economic hardships, all of it has taken a toll on its people. In the last 20 years, things were steadily getting better. But the Taliban's return has erased all those gains.
Previously, 3, 4 or 5 men or brothers used to be busy and work. They didn't have time to come home. And if they happened to come home, there was money, work and more affection. Currently, men are also unemployed. When a man is idle at home, he becomes tense or angry.
Afghanistan needs to talk about mental health. But for that, they need a receptive government, not a regressive regime of hardliners. South Asia Bureau, WION World is One.